PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare and Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we have a caller on our 212-CHOICES line. So, good evening, sir.
Yeah, hi, good evening. How are you?
Fine, thank you. What's your question tonight?
I would like to ask about glioblastoma, recurring
Okay.
glioblastoma.
Okay. All right, do we treat it? How we treat it? Okay, so I'll tell you many things about recurrent glioblastomas. Number one, we were the first in New York with radiosurgery. So when we started radiosurgery, every other facility, every hospital was still doing whole brain or standard radiation, treating large parts of the brain, while we were able to focus in, zero in, treat the tumor without hurting the brain. So it put us years, and in some ways decades, ahead of every other facility in New York. Glioblastomas are one of the most vicious brain tumors, obviously. They're grade 4, stage 4, aggressive cancers of the brain, a primary cancer. They usually start in the brain and usually stay in the brain, not always, but usually. And we have developed a program where we're able to use radiosurgery for glioblastomas, both at diagnosis and at time of recurrence. And in general, our patients will live about 50% longer than those in the literature treated with the usual radiation and Temodar. So we have the ability for most patients to treat and even retreat with radiosurgery. Each patient's different, and I obviously can't diagnose over the phone, so you'd have to bring in the scans. It's better to bring in the patient so we can see everything and sit down and spend an hour or 2 hours together.
What about a 70-year-old patient who was actually diagnosed 2 weeks ago? She had her primary surgery.
Uh-huh.
And supposedly everything was removed, and they will probably start with Temodar and Avastin or something like it.
Well, actually, excuse me. This is for a newly diagnosed or recurrent glioblastoma?
I'm asking now, okay, the recurrent, let me tell you what it is.
No, just if you could ask, excuse me, sir.
I had a family member who passed away.
No, but just excuse me. We'd have to focus. I just asked a question. Is the patient newly diagnosed or recurrent glioblastoma?
Newly diagnosed.
Okay, well, the answer is there's a randomized study that looked at patients who got Avastin versus didn't get Avastin, and the patients who didn't get Avastin lived longer. So if you're going to doctors that are giving Avastin, there's actually a study that shows it decreases success rate. It doesn't increase success rate. So it's a complex issue, and really you need to come in and spend an hour or two. It's not a phone call, but we have a lot of data. We have more experience than any other facility in New York treating glioblastomas with focused beam radiation, more than any facility.
And you do it concurrent with the Temodar?
Yes, sir. Yes, sir.
Yes, huh? Yes,
Yes,
okay.
sir.
Okay, thank you very much.
Okay, God bless you. If you have questions,
Make an appointment.
make an appointment and we'll send you a booklet and DVD. And if you have other questions, we can talk more obviously in person or on the phone. But there's many issues. But the reason to come is our experience, which is really long, and knowledge is pretty vast. Thank you very much, and God bless you.
I hear you. Thank you.
Bye. God bless you. Bye-bye. Good luck. And we had another caller who called. You're welcome to call back, but sad to say I can only speak to one person at a time. I want to talk about another patient in the good news department, and that is a man who had a Gleason 7 PSA 20, so high risk. What is high risk in prostate cancer? Well, the Gleason score is how the cancer looks under the microscope. He had a Gleason 7. Everything 7, 8, 9, 10 is considered high risk, and PSA more than 10. PSA is the blood test of prostatic-specific antigen. So both were elevated. He was treated with us more than a year ago. He just went on a cruise with his family and high school friends. He's about 65 years old. He's sexually active after our treatment. His urine is under complete control. He's having a good life, and his PSA is down to 0.7. So he's in remission after high-risk Gleason 7 PSA 20 prostate cancer, fully active, sexually active, urinary life active, and we know the data for surgery results, and it's in our booklet if you want to see what's your likelihood of being sexually active after surgery. Well, only 2%. 2.9% of men after surgery had sexual activity normal. The rest were abnormal. Hello, it's Dr. Lederman. Good evening. You're calling on the radio show. You're on the radio right now, sir.
Oh, okay. I was just a friend of mine went from healthy to a very bad problem. Diagnosed with stage 4 lung cancer.
That's sad.
And they had an ambulance back to New Zealand. Apparently, the cancer's eaten through the spine, L3.
Mm-hmm. Sorry to hear that.
I don't know if that's something that you could treat him in.
That's exactly what we do. In fact, if you open up our body booklet, you'll see a patient whose cancer ate through the spine. We treated them, and the follow-up showed complete healing of the spine. So our success rate for metastatic lung cancer, where we aim the beam, is about 90%.
Wow. All right, I'm going to reach out to his family. They're in New Zealand. I'm going to see if I'm going to put them in touch with you.
All right, they're welcome to do so. And if they have questions, they can call directly. And, of course, we'll send them a booklet DVD, but it's obviously best to talk in person.
I'll have them call directly.
That'd be great. Just call that same number, the 212-CHOICES, which is the number I think you just called, 212-246-4237.
Fantastic, Doctor.
Thank you very much for calling back. Bye-bye now. Oh, okay. Thank you. Bye-bye. Okay, and so we're talking about this gentleman, sexually functional, urine control function, and in remission for a high-risk prostate cancer. That's the kind of work that we do, and we do it most every day. We had a plumber who came in, a man, really interesting man. He's 69-year-old plumber from New Jersey. He had elevated PSA. His PSA was 9, and then it went to 5, and then it was 4.6, and he saw a urologist who said, well, it's going down, let's leave him alone. And I said, well, you have all 3 PSAs that are abnormal. Most people would get a biopsy for any one of those PSAs, 9, 5, or 4.6. So he came into my office on Wednesday, and I said, well, let's get another PSA if that's what it takes for the urologist to do the right thing. And the new PSA is 9.2. Got another caller on the line. Good evening. It's Dr. Lederman. You're on the radio show.
Good evening, Dr. Lederman. I have a question about an acquaintance of mine.
Okay.
Stage 4 bladder cancer.
Sorry to hear that.
Is this a cancer that you treat, or what are the chances of successful treatment?
Well, we need to see exactly how he's stage 4. Stage 4 means that the cancer has traveled through the bloodstream to other spots. So bladder sometimes spreads to lymph nodes, sometimes it spreads to liver, lung, bone.
So And
Well, prostate is local. The prostate's just next to the bladder. So when some bladders grow locally, they grow into the prostate. So that's local. That doesn't make it necessarily stage 4. So it depends how he's stage 4. But I can tell you that our success rate for treating metastatic stage 4 bladder cancer, where we aim the beam, is about 90% non-invasively. We also have many patients, and I've talked about it on the program this year. We had one woman who was 100 years old, is 100 years old. She was bleeding out, nearly dying from bladder cancer. We gave her radiosurgery, 5 treatments, and she's in remission.
Yeah.
Actually, I think she had her birthday. I think she had her 101st birthday in September.
oh, great.
So we need to see the patient.
I suggested to him and see what he said.
Yeah, give the number. Let him call. I'm happy to speak to him directly. We don't have machines. We don't have gadgets. We talk as one human being to another. And I'd be happy to see him, send him information, send him the DVD, whatever's best and suits his wishes.
Okay, thank you so much.
All right, God bless you. Bye-bye now. Okay, so I was talking about this man. So he had 3 PSAs. We sent him for a 4th PSA this week. He was from New Jersey, so all the other PSAs were from New Jersey. So I got the 4th. It's 9.2. The urologist, the patient, his wife are all in agreement. He needs a biopsy. He wants to live. He wants to be normal. We have another caller on the line. Excuse me. Hello, it's Dr. Lederman. You're on the radio.
Hi, is this the doctor's wire?
This is the doctor. You're on the radio, and you have 50,000 people listening to you. So don't be nervous.
Hi.
Good evening.
Hi there. I have clavicle cancer.
Sorry to hear that.
It's non-Hodgkinson lymphoma.
Mm-hmm.
I originally, a few months, maybe a year back, I had cancer of the lower spine, but radiation healed that.
Mm-hmm.
So that's under control. I'm 83 years old, young. They say I'm in great health, except I have cancer.
Okay.
Do you work on the clavicle?
Of course.
Side?
There's not one spot in the body we don't work on. Actually, we have a patient just like you with a similar lymphoma in the same area, 5 treatments in complete remission. So lymphomas are very sensitive to radiosurgery. What's different about us is we were the first in America to perform radiosurgery, which is non-invasive. It's no cutting, no bleeding treatment. We can zero in and just treat the cancer area and leave your body alone. 5 treatments, and most likely it will be successful where we aim the beam.
Yes, because they're afraid to do it. They're afraid they'll break the clavicle.
Yeah, well, we're not afraid. In fact, our treatment will probably heal the clavicle.
Well, that's good.
Mm-hmm.
Okay, that's good news. I'll see you soon.
Okay, give us a call. And if you have other questions, call anytime.
Oh, thank you. I have no pain. I'm so lucky.
Okay, you can take the train in right to Grand Central. We're just a few blocks from Grand Central Station.
Oh, that's good.
Okay?
Thank you.
God bless you and good night. Bye. Okay, we're going to stop for just a moment to have a station identification to talk with our sponsor. If you have questions, you're welcome to call the studio, which is 800-321-0710. Noah and Ed are running the phones. They're running the station. My name is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center where we work for the patient. We don't take money from the drug companies, the surgeons, and others. We work for the patient. We accept Medicare, Medicaid, and most insurances. You're our boss. In our view, you are the president of the United States of your body. You get informed and you choose. You are the boss, and we work for you. So this is Dr. Lederman. We'll be back in just a moment.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accept it. Call Dr. Lederman at 212-CHOICES. 212-CHOICES for a fresh second opinion and free booklet DVD.